Hi everybody, and welcome to the latest of our short series of webinars thinking about complex care in lockdown. I hope that everybody is well, and I'm absolutely delighted to be joined by Liz O'Donnell today, who we connected on Twitter. We were just having a discussion excuse me, about Twitter and just how fabulous it is. So we're going to think about proning. First of all, Liz, do you want to quickly introduce yourself?
Okay, so my name is Liz O'Donnell. I'm a physio that specialises in learning disabilities. I've been working in community learning disabilities now for nearly 11 years, which is a bit horrifying. But I have a particular interest in posture. I'm trying to keep people as posturally aligned as we possibly can so that they can get the best possible quality of life. Obviously, in this current climate, it's really quite difficult to be trying to get out and assess and treat and help people. So any way is gratefully received. And this webinar hopefully will give some people some advice on proning and when not to do it with people with complex body shape.
Brilliant. Thanks, Liz. So let's take a quick look. So we're going to stay in the corner for this one. Just because we've got, see, look, I've gone straight to the end. I'm going to start at the beginning. So complex needs for people, proning and things to consider for people with complex needs. I feel like I've given you like we've done the last page of a book. So proning, what is it? And I have to say a massive thank you to Liz Herrigan, who's a consultant in emergency medicine, who shared some material with me again through Twitter. So this is some information that Liz sent to me that I have tried to make it more accessible. So if there's any mistakes here, then they're my mistakes. They're not Liz's mistakes. But basically, she's helped me to understand that the reason that we put people into prone, so onto their tummy, is because when you're on your back, then we collapse the air sacs towards your back, and we get overinflation of the ones at the front. And then we get squashing of the air sacs due to pressure from your heart and from the contents of your tummy coming up. This is when you're flat on your back. But the air sacs at the back have a better blood supply. So if they're squashed, they're less able to provide oxygen to the blood, and people often have difficulty clearing secretions as well if they're flat on their back. Compare that to being on your tummy. Then the collapsed air sacs are able to be opened up again. We get better aeration throughout your lungs, and we get better blood flow because you've got better blood flow to the air sacs, which are at the back, and the ones that are better aerated, then you get better blood oxygen levels, and people are better able to clear their secretions. So she sent me some guidance that was saying that people who are conscious may need cushions and postural supports to help them to get comfortable, that positions should be changed every 1 to 2 hours. And when people are not in prone, sitting up, propped up, is better than lying completely flat. So I hope that I've done Liz's explanation to me justice there. So basically, we put people onto their tummy to get better aeration in their lungs. So Liz, I'm going to hand over to you, just so that you can go through what you were talking about and what you've been sharing around considering proning for people with complex body shape.
Okay, thank you, Sarah. And I think that you explained that quite well. I think there was some good information there about exactly why all of these doctors, nurses, physios, OTs, everybody up on those ICU wards are trying to get people into prone, lying on their tummies. It can be really, really valuable for people to get into that position. But what I want to think about today is how that would affect people with the more complex body shapes, where we've got these really fixed spines, fixed backbones, pelvises are all a bit wonky, heads that don't quite move in the way that they normally would do because they've got fixed contractures there, that people are kind of stuck in these really complicated body positions. We spend a long time trying to get them positioned well with equipment, with cushions and pillows and specialist sleep systems and chairs, much like are provided by companies such as Simple Stuff Works. But we're not always aiming for that tummy position. even though it's going to be doing all of those fabulous things that Sarah has been talking about. The reason for that is, that, well, there's quite a few reasons really. Being on your tummy is not safe for all people, okay? And if you've got a really complex body shape, if your head is fixed in a funny position, you may not be able to move your head and neck in a way that means that you can actually breathe in and out when you're on your tummy. You might have such a complicated spinal position and rotation of your spine that you can't, even with all the pillows and support equipment in the world, get to be on your tummy in a comfortable way. And at the end of the day, comfort is one of the biggest things that we're aiming for here. There's also some health conditions that you've got to be really quite careful of when being on your tummy. So things like intracranial pressure building up, so the pressure in your brain, and some people have more of a predisposition for that happening depending on the health conditions. Things like gastric reflux. If you're lying on your tummy and you've got really bad reflux, you might just end up aspirating. You might get those food contents, whatever, down onto your lungs and end up getting a chest infection. You'll be in a worse position than you were when we started. The other thing that we've really got to think about in these people that have got very complex body shapes is exactly where are their lungs. People are lying on their tummies so that we can get all of that air, as Sarah said, to the back of the lungs and open up those air sacs at the back. But if you've got a really complex twisted spine, those lungs might not be where they anatomically are supposed to be. So these are all really important things. The last one that is not on that diagram there is that people with cardiac problems, people with severe heart problems, you can actually cause serious problems by lying on your tummy. I think the biggest thing although is you think about how difficult it is for people with complex and fixed body shapes to have even the littlest change in their body position. If we take, for example, people who are learning to sit in a new wheelchair, they might be looking really spectacular in that wheelchair, really straight and aligned and beautiful from an alignment point of view. But because it's such a big shift from where they've been used to being, it can be quite uncomfortable. Changes in posture and body position for people with a complex body shape, even the tiniest change can be a really big deal. So if they're used to lying on their backs in their sleep systems, perhaps lying in a bit of crook lying, just to whip them around onto their tummy, it's not something I would recommend. I think that I personally look at with my clients and service users that I work with, I spend a lot of time looking at the different body shapes and positions and postures that people can be in over the day, and looking at how that affects their lungs and their breathing and their ability to clear secretions. And I would often go for that more crook lying position that Sarah mentioned at the beginning. So having someone lay at their back, but with them propped up from the hips almost, so that they're nice and straight. We're not squishing that body shape forwards, but we're allowing a little bit of elevation. And that would be probably where I would aim for first with these people with complex body shape. It's important, I think, for me to state that I'm not saying that this is the case for everybody. And if you have questions about proning for your specific child, your loved one, your person you're caring for, your service user, then you need to get a detailed individual assessment from their individual therapist. So from their OT or their physio, from your local learning disability team, from the paediatric team, or seek advice from any of the healthcare professionals that work individually with your person, because obviously I can't tell you for individuals, but it's all about looking at safe, individualised assessments, and taking it from there really, and hopefully getting people in the best positions that we possibly can to give them the best chance of breathing properly as well as they can. And that doesn't necessarily mean being on their tummy. I hope that that has given people a little bit of an idea about my thinking around this. And I know that the next slide has my Twitter details on there. So if anybody does want to talk about it further, you know where to find me.
Fantastic. Liz, thank you so much. So I think I couldn't agree more. It's that idea, isn't it, of for everybody, you know, whether you have complex body shape or not, then it's about an individualized assessment of risk and intended benefit, isn't it? So I love that on your diagram there we've got almost a checklist for people to work through. So think about people's head and neck position. Think about whether they are able to get flat at their hips and their knees, intracranial pressure, gastric reflux, whether they have a gastrostomy, whether they have a trachea, and then we've got position of the lungs and whether actually, you know, kind of the theory it fits for the person that you're thinking about. And the one that you mentioned as well was cardiac instability as well, wasn't it? So
yeah. Sorry for not having that one on. Forgot.
No, not at all. It's that whole. But it's great just to have the beginnings of some ideas of things that people could think through. So as you all know, the last slide has got everyone's contact details. So we've got Liz O'Donnell, who's presented here today. Liz Herriven, who helped me with regards to my understanding of proning. And as I say, if there were any mistakes in that, then they are mine. They're not Liz's. Myself, Sarah, and our Simple Stuff Works Twitter handle and our website. So thank you so much, Liz. I'm going to come back to you. Thank you so much for taking the time. I should explain that we've had to do this twice because the first time the sound didn't work. So I've interrupted Liz's life twice now to get her views on proning, and both times she's obliged, and I am really appreciative. So thank you ever so much for that.
No, you're very welcome. Thank you for having me.
No problem at all. It's like a little party here every day. Thank you ever so much. Stay well, everybody, and take great care. See you soon.